Okay, so once you've taken care of joint alignment, nerve supply, localized muscle, and ligaments, then we want to start looking for things that aren't such a big deal anymore. These are the smaller little things, but also very important, and especially for maybe those chronic patients that you haven't been able to help. You want to start looking at these little details and see what's going on in the joint. The next thing is we're going to look at holographic subluxation, or a bent bone. Okay, so any bone can be bent. Usually the longer bones, the thinner bones like a clavicle, a humerus, tibia, fibula, femur, those are the ones that are usually bent the most, and the ones that have the most muscles attaching to them. It can also happen to a vertebra though. If a vertebra has a hologramic subluxation, the nerve supply and meridians will be altered a lot too, that are adjacent to that vertebra. So what you want to do, say if you're doing a long bone like the clavicle, you want therapy localized proximal and distal, make sure those are both negative, but when you therapy localize together, that will create a weakness. And then you have to just challenge bending different ways. Do a challenge like 1, 2, 3. Do a regular challenge in all different directions. And you want to find out what the challenge direction is. And you want to see what breath negates the challenge. So basically you're going to adjust for respiratory adjustment in the challenge direction on the breath that negated the challenge. That could be with any long bone and also with the vertebra. So you would challenge the spinous and the transverse processes together, apart and together. Find out which way weakens. Find the breath that negates the weakness and adjust on the challenge direction on the breath that negated the weakness. Okay, very important. Bent bones, hologramic subluxations. Next thing to check is skin or scars. If there's a scar, get therapy localize it. See if it creates a weak muscle to go strong, or if there's strong muscle, therapy localize the scar. See if it creates a weakness. So if you have a scar that creates a weakness, what you're going to do is you're going to challenge the scar in different directions. Start with a strong muscle, okay? If you have a weak muscle in the joint, find a strong muscle that's associated with the joint, around the joint. Challenge the scar in different directions. Find out which direction creates a weakness and find out which breath negates the weakness. Do friction rub on the scar, adjusting it into the direction that created the weakness with the breath that negated the weakness, okay? Now, if you are starting with a weak muscle and you challenge it for strength, then adjust it in the opposite direction on the breath that negated the challenge, okay? So if you're starting with a strong muscle or a weak muscle, you're going to do it in different directions. Now the skin around a joint, if there's been a shearing injury to a joint or a trauma, the skin could be, the proprioceptors in the skin could be malfunctioning. So you'd want to grab the skin and actually like roll it in all different directions. And a way to just test the joint is to just pull on the skin, just tug it, and see if that creates a strong muscle to go weak. It's best to start for strong muscle. You can do it the opposite way too, but then you have to adjust the opposite way that you find it. Strong muscle, tug the skin, creates a weakness, challenge in different directions. You're going to go in the challenge direction on the breath that negates the challenge, adjusting the skin over a joint. This is not going to happen with every single injury you have, but these are the little details you want to check later. Next thing is the motions of a joint. Say you've been working on someone's knee forever and everything's been strong, everything's fine, there's still something going on. Have them touch the ENVs, or emotional neurovasculars, test the knee joint and see if it creates a weakness. Whatever you find, you want to correct it while the patient is thinking about whatever emotion came up from you working on the emotional neurovasculars. If it's origin insertion, have them think about whatever the emotion is you found. If it's a joint alignment adjustment, have them think about whatever you found. If it's actually the nerve supply, have them think about whatever you found as you're doing the correction. Okay, so associating emotions with a joint. All right. Supplementation. Now, just of course, going back to 5 factors here. Whatever muscle that you're working with, what's the related organ meridian? Check supplements for that muscle if it's not working right. Okay, and also, there's lots of different nutrients to just check for joint injuries. You have a lot of joint nutrients, a lot of ligament nutrients, a lot of muscle nutrients. So know your nutrients and just check those muscles for the nutrients. So either 5 factors of what the muscle is related to or just joint nutrients. The last thing to check, nothing else has worked at all, any joint with the TMJ. Okay? So you can find a weakness in a joint somewhere, therapy localized TMJ, see if it strengthens, correct that TMJ. Don't forget, the TMJ controls a large part of the nervous system. If you look at a homunculus of the brain, you see TMJ and lips and tongue. It takes up like 35 to 40% of the motor and sensory nerves of the nervous system. So TMJ could always be very important for anything going on in there. So remember, stick with the basics. Joint alignment, nerve supply, localized muscle work. Then start going to other things like ligaments, bent bones, skin, scars, emotions, nutrients, TMJ, and you're going to have a lot of these things fixed when no one else could have them. You're going to save people from months and months of rehab or just people going through chronic pain and just not being able to walk right. All right, and thank you very much and hope you do well with all of this.